Results from the SWOG Cancer Research Network are highlighted in 5 oral abstracts at the ASCO 2022 meeting. LungMap substudy S1800A finds that in patients with advanced non-small cell lung cancer that had progressed on prior immunotherapy, the combination of ramucirumab plus pembrolizumab reduced the risk of death by 31% compared to standard of care treatment. This is the first trial to show a survival benefit from combining an immune checkpoint inhibitor with a VEGFR2 inhibitor in these patients. Results from the SWOG S1512 trial in patients with desmoplastic melanoma show that PD-1 blockade therapy can significantly shrink these tumors before surgery. Patients were treated with 200 milligrams of pembrolizumab every 3 weeks for an average of 3 cycles. The observed frequency and extent of the clinical responses suggest that upfront immunotherapy may significantly reduce the extent of potentially disfiguring surgery needed by these patients. Researchers working with samples and data from the S1314 trial in muscle-invasive bladder cancer have used methylation patterns in cell-free DNA extracted from plasma to predict which patients have tumors that are likely to respond to neoadjuvant chemotherapy. If validated, a biomarker of this sort could save many patients from having to undergo chemotherapy that would provide them little benefit. An analysis by SWOG Health Services researchers finds that the Affordable Care Act's expansion of Medicaid in 2014 was followed by a significant rise in the proportion of patients enrolling to SWOG trials who were insured by Medicaid. The researchers estimate that by early 2020, the rate of participation by Medicaid patients was roughly 3 times what it would have been had Medicaid not been expanded. And finally, the S0931 Everest trial randomized more than 1,500 patients with high-risk renal cell carcinoma to a year of adjuvant everolimus versus a placebo. Everest researchers saw a tendency to longer recurrence-free survival in patients on the everolimus arm, although the results narrowly missed the trial's pre-specified significance level. Patients with very high-risk disease, however, saw a 21% improvement in RFS, despite a high treatment discontinuation rate.